Greetings, fellow Americans. My name is Asher Lee, and I'm a senior at American Heritage High School in Plantation. And I'm talking about the problem of albuterol sulfate. So, the main issue with albuterol sulfate is demand has skyrocketed and supply has plummeted. So, right now, really because of COVID-19, there's become a shortage of albuterol sulfate because of how COVID is a respiratory disease. So, with the supply portion of it, really it's because companies like Acorn and Nephron Pharmaceuticals have stopped producing albuterol sulfate. So not only does this create a deficit of treatment in the patients, but it's also caused a lot of them to turn to the alternative levalbuterol hydrochloride inhalation solution. And while this is still as effective as albuterol sulfate, it's way more expensive than albuterol sulfate. And there's just no reason to be spending this money for really essentially the same effect. So another one of the problems with albuterol sulfate is not the accessibility part of it, but the actual drug itself. It was covered earlier that albuterol sulfate does lead to addiction. Not really addiction, but sort of a dependency on the drug. And so we've created the 4 A's of solutions to the problems concerning albuterol sulfate. We have availability, accessibility, affordability, and acceptability. So for availability, what we want to do is make sure albuterol sulfate can be registered in countries where citizens need them. Accessibility, each country should try to incorporate albuterol sulfate in their hospitals through regulations. So what's very important in this little blurb here is regulations. So we want to teach, we not only want to promote the use of albuterol sulfate, the cheaper alternative to its counterpart I mentioned earlier, but we also want to make sure people are using it right. We want to make sure people aren't just continuously huffing and huffing and huffing it until they actually suffer like serious side effects. We also want to make sure that albuterol sulfate is not abused, because it was mentioned earlier how some people will huff albuterol sulfate for a sort of high, because as soon as you take it, you're increased oxygen intake, a very brief euphoria. So some non-asthmatic people are still inhaling this thing. You want to make sure this isn't happening. So countries will be incorporating albuterol sulfate in an ideal world, but regulating it, making sure people aren't abusing it and using it the right way. For affordability, countries should strive for cost of medications are able to be bought with less than a daily wage. So what we're aiming with affordability is making sure people can afford this already cheap drug. There's a lot of cases, even in the US, especially where healthcare is privatized and not publicized, I guess. But basically want to make sure that people who can't get the drug in the US can get it, especially with the huge lack of albuterol sulfate recently. We want to make sure that the cost of it is not pushed up as it has been recently. We want to make sure it's able to be brought down so this really life-changing and life-saving medication can reach everyone. For acceptability, we want to make sure that when this product is introduced to patients, the patients will feel safe in taking this product and face no discrimination when using it. So right here, we're targeting a few stigmatizations, although they are lacking a little bit. We want to make sure that the people that are taking this medication do not feel ostracized from society anyway. Asthma is a huge deal. You can't participate in things like sports sometimes, or like other activities, or you can't really be anywhere around smoke right anyway. So we want to make sure that there's no judgment coming from people. And with these 4 A's, we hope to improve the problems with albuterol sulfate. Thank you.